The first thing that we have that many other programs don't have is an integration between our neurologists and our neurosurgeons, our neuropathologists and our neuroimagers. We are a program which is really unlike many others, and that really is the legacy of Charlie Drake and Henry Barnett.
There's no question, as I've gone through this process past 20 years, we still have the best training and education for surgeons, bar none, in the world.
We have some of the leading imagers in the world working on the brain. We have resources in terms of magnets, so for our MRI imaging, for our CT scan, our PET imaging capacity, all within a stone's throw. You don't see that anywhere else.
I think it's something we should all take as a source of pride in London and in the Southern Ontario community, that we can attract people of Dr. de Ribaud-Pierre's caliber to London. But she and her engineering colleagues are also interested in simulating procedures on the brain in virtual environments to help us learn how we can better train people, young people like young neurosurgeons and young radiologists for the future.
Currently in neurosurgery, there is no simulator used in Canada. The National Research Council is building one to look at tumors, which is a different device as what we would like to get here, which is more neurointerventional, looking at inside vessels.
Dr. de Ribaud-Pierre's focus is on evaluating the quality of skills training, the quality of improvement that exists in educating surgeons using simulators. It's one thing to have a simulator and this new technology. Similar to this technology, fine, you've got it, but does it really make a difference? That's a harder question, and that takes brain power and work and human resources over a number of years after the technology has been developed.
Simulation is really important in my mind, because we're able to repeat the same task over and over until we're able to achieve it perfectly. Nobody would fly an airplane without having spent hundreds of hours on a simulator, versus we expect surgeons to actually learn on patients looking at a surgery.
One of the old wisdoms in surgery and in medicine generally, I think, as well, is that the better that you train a young person to become a doctor or to perform a procedure in the future, the better it's going to be for patient care, and they're going to advance the field. The students are going to advance the field and hopefully advance it even further than you did during your career.
What brought me to the hospital initially was I was having severe headaches. It was ongoing for about 2 weeks.
He had hemorrhage in the brain, which is something that normally neurosurgeons, that we're the ones that deal with that. And we could see that on the CT scan.
It was a bleed, and they suspected that it was bleeding for about 2 weeks. It ended up turning into a major incident, of course. I was amazed at all aspects of the hospital, really, and the quality of care.
One of the most rewarding things is having good outcomes. I mean, that's why we do this job, is having good outcomes, like Mike, for example. I mean, that's that makes the job worthwhile. Appreciation
for the little things. My twins' first day at school, then was able to walk to school and pick them up from their first day of school, and that was the first time I'd seen them in 8 days, and it was something as simple as picking your kids up from school is something that you take for granted.
Donated money through the foundation is helpful for a lot of the extra, the special items that we use that are kind of outside what we would normally get in the hospital. I think allows for quicker care for the patient.
Thank you. Thank you to those financial donors. My story could have been very different.
For the last 10 years leading up to 2010, the annual philanthropic dollars were put towards an innovative intraoperative X-ray machine. This year, we're happy to put the support of the Drake Tournament towards a simulation technology, a little bit of a change of focus, and a little bit of a shorter term, shall we say, payback on the investment that our donors have made in neuroscience and neurosurgery.
By having donors, it allows us to take that next generation and say, go for it. Here's your resources. These things change healthcare.